a very brief webinar based on our Level 2 award, which we normally deliver to professional home care workers. We've changed that so that it's more appropriate for you in your role as an informal unpaid carer at home. So we hope you'll find it of some use. So I'm just going to get the slides up now, and then we can go from where we are. So basically, let's look at the aim of this brief webinar. In essence, is to understand what behaviour that challenge is and how to support individuals within a health and social care setting in general, but certainly for you, how to support individuals at home and how to look after yourself as well. There's a few learning outcomes. We always like to have learning outcomes to these webinars. First is a definition of behaviours that challenge and understanding why individuals exhibit those behaviours. Secondly, to look at some of the different stages of behaviour, how we look at behaviour and how we identify behaviours that we find challenging and how we can support them. Thirdly, to have a little look at the role of medication in supporting behaviours that challenge. Fourthly, to understand the role that communication plays in supporting behaviours that challenge. To think about some strategies and functions of behaviour. One of the things we're not going to look at today is understanding and restrictive interventions. That's, I think, beyond the realms of what we feel comfortable doing within this setting. So we're not covering that today. So, but those are the learning outcomes, and we hope you'll get something out of that. So, what do we mean by behaviours that challenge? Royal College of Psychiatrists helpfully defined this for us in 2016, and they've said it here: behaviour can be described as challenging when it is of such an intensity, frequency or duration as to threaten the quality of life and or the physical safety of the individual or others, and is likely to lead to responses that are restrictive, aversive, or result in exclusion. I think that's an excellent sort of definition of behaviours that challenge, and something that I'm sure that you can identify with. So behaviours that challenge used to be described as problem behaviour, difficult behaviour, socially unacceptable behaviour. Now it reflects the fact that some behaviours provide a challenge to professionals, provide a challenge to support workers, and obviously often to you guys as parents. It shows that something is not working, a need is not being fulfilled, or there is a problem somewhere with communication. It doesn't show necessarily a problem that needs fixing, or that there's someone who's doing something wrong. It is a problem if it causes harm to others or stops the individual from doing what they want. It's the impact of these behaviours that makes them challenging. Behaviours that challenge can be self-injurious, whether that be head banging, scratching, pulling, eye poking, picking, grinding teeth, eating things that aren't food. But they can also be aggressive, biting and scratching, hitting, pinching, grabbing hair, pulling, throwing objects, verbal abuse, screaming, spitting. And it's, again, the impact of the behaviours that make them challenging. They can be stereotyped, repetitive movements, rocking, repetitive speech, repetitive manipulation of objects. They don't always have to be person-directed. It could be damage to property, it could be hyperactivity, it could be stealing, inappropriate sexualised behaviour, destruction of clothing, incontinence, a lack of awareness of danger, withdrawal on the part of the person. But I think the important thing is we think about why behaviours occur, because we know there may be many reasons, or more often than not, a combination of reasons for behaviours that challenge. Some are simple, some are much more complex. Some are biological, they may be to do with sensory issues, pain, genetics. Some are more psychosocial, the negative life events, lack of communication skills, impoverished social networks, a lack of any activity that's meaningful, some psychiatric difficulties, some mood difficulties. And then what you have here is, if you look at the pyramid, you have, I suppose, what you might regard as an intensity level. You know, with the top one being the top 5% of behaviours, which are really very intensive. So in terms of understanding behaviour, one of the things we also need to look at is the different stages of the behaviour. As you'll all know, behaviours that challenge don't just happen. They don't appear out of nowhere. They usually develop over time. They usually develop in stages. And it's generally recognised that there are 4 distinct phases here. Firstly, the proactive phase, and that can be when the person is calm and relaxed and there are no behaviours that challenge. Then the active phase, the point at which the person starts to become anxious. And what we do know quite often, for those of you with experience, is that quick action then may end up avoiding the behaviour. Then there's the reactive phase. That's when the behaviour actually occurs. And then the post-reactive phase, the person starts to come out of that behaviour and starts to relax again. Now, for those of you who care for somebody who has behaviours that challenge, or behaviours that are seen as being challenging, sometimes there's you've possibly gone through an assessment of that behaviour, what they often call a functional behaviour assessment. It's a process that identifies specific target behaviour, purpose of the behaviour, and what factors maintain the behaviour that are interfering in that individual's quality of life. And analysing what happens immediately before the behaviour itself, and what happens immediately after the behaviour, is to help determine the function, why that behaviour is happening, and what's actually maintaining it. And it's important when we talk about supporting behaviours that challenge, this is what we're talking about. So it's support to make sure that the individuals feel valued and listened to make sure that where communication disorders exist, the individual has a method of communicating effectively, to reduce, where necessary, the expectations of other individuals around that behaviour, to determine the triggers in the environment that might provoke behaviour, and that could be noises, attitudes, beliefs that might provoke that behaviour, to look at ways in which we can give the individual other ways of communicating their needs, help the individual and their carers to recognise distress, and develop the individual's coping strategies for dealing with problems. And this is, again, what we're looking at here in terms of support, is about anticipating potential problems and intervening where appropriate, for example, by providing additional support, redirection to another activity, or reducing the noise level. To look at training and support for care and support staff in prevention and managing difficulties. And this is where this kind of thing comes in for you, is to look at, see what training and support that you need. Make sure that you're sharing knowledge and expertise. Make sure that you have a variety of activities and meaningful materials that are appropriate and can help you in terms of managing that behaviour, ensuring that you have appropriate levels of support, and ensuring that everybody who's involved with the individual who is manifesting behaviours that challenge knows that you're providing a consistent approach to that. And more information around those behaviours can be found on the Scope website, which is at www.scope.org.uk. Just want to say a little bit about self-injurious behaviours. I mean, self-injurious behaviours, any behaviour where the individual can cause harm to themselves. Standard behaviours like this are head banging, eye or skin poking, picking, self-biting. And the individuals who are more likely to display this self-injurious behaviour have got often got either profound or severe learning disabilities. They may have sensory impairments such as sight or hearing. They may have expressive language difficulties, no speech, mobility difficulties, and also autism. I just want to say a couple of things about these two things. You may have heard of them, pica and polydipsia. Pica is eating inappropriate objects such as stones or clothing, sometimes feces or raw food. And then polydipsia is similar, only in terms of drinking anything liquid, and that could be bleach and toilet cleaner, washing up liquid toiletries. Both can be quite dangerous. Just want to touch briefly on sexual behaviour, and obviously it's understandable that people with learning disabilities may have the need for sex and relationships. Ideally, sexually suppressant medication should be avoided. The important thing is that clear boundaries need to be set. Sexual urges need to be managed appropriately, which will help to reduce any inappropriate sexual behaviour. And it's important, if you're dealing with somebody who has challenging behaviour around this, is to look for patterns. Often people engaged in unwanted behaviours when they're bored or have little else that's interesting them. Just to talk a little bit about medication. There's been a really long history of treating behaviours that challenge with medication, using tranquilizer medication to treat this type of behaviour has in the past been used excessively and often inappropriately. Nowadays, medication is something that should only be prescribed, I should say, following a proper assessment and where a clear reason for its use has been identified, and all other potential causes for the behaviour have been explored and dealt with. So, physical illness, mental health problems, side effects, we need to look at those things first. Some of you might have heard about something called the Stomp campaign. That's about stopping the over-medication of people with a learning disability or autism or both. This is a really important campaign that's been aimed at preventing over medication, and it's something that we're really very much in favour of. I want to talk to you a little bit about communication. Comes down to it, all behaviour is a form of communication. And when people have difficulties with communication, they can often express their frustrations through their behaviour. And improving that communication will help to reduce or stop maybe even the behaviour that challenges. So if this behaviour gets what the individual wants, for instance, they learn that they can repeat the behaviour to get what they want. So again, you can see how all behaviour is a form of communication. So what can cause communication difficulties? It's important. For instance, with difficulties is people understanding what people are saying. It may be that their hearing impairment has not been detected. It may be that their understanding skills have been overestimated, or it may be something more like that. For instance, they have difficulties in understanding abstract concepts. And sometimes there's difficulties in communicating a message to others, difficulties in producing clear speech signs, lack of words needed to send a message, using the right words but in the wrong order or without the appropriate body language. And there are many ways in which we can overcome these difficulties. This is something that, in terms of skills and training, something that we want to move towards. So you can make sure that you're communicating in a way that the person understands. This may include using simple, short sentences and trying to avoid saying something which could be misunderstood. Objects, pictures and symbols, sign language, voice output communication aids are all ways of supplementing spoken language. Reminding people of what will be happening throughout the day is really important. understanding what the individual's telling you, and then give them a better way of asking for what they need through maybe teaching new skills, new coping mechanisms, and tolerance of or changing care and support staff behaviour. Ask yourself, can you teach the person additional vocabulary? Are you teaching the person to ask for a rest? Again, what we want to do briefly is, as I said before, we would look at the functions of behaviour. And I think, again, when it comes to behaviours that challenge, as with all behaviours, it's really important to think about why that behaviour exists. What's the function of that behaviour? Here are sort of like 5 different functions of behaviour. Reduce experience of pain or relief from, I should say, internal discomfort, external or internal. It could be, it's a pain reduction. There can be some tangible reasons. So desire for an object. Somebody wants something. It could be about attention or interaction, and the need for a good quality interaction, not just being given a list of commands, for instance. It may be because it's about escaping from demands, not wanting to do something, not wanting to undertake a task. Or it could be sensory or about stimulation. The behaviour might provide good, calm feelings. So all behaviour has specific functions attached to it. Now, the key is, of course, is to look at strategies in which you're actually looking at people's behaviour. Let's have a first look at proactive strategies, what they are. The proactive strategies are fundamentally what they say on the tin. They're what you can do to support the individual and their needs on a day-to-day basis. There are a range of changes we can make in the person's life, their environment, ways through which we support them, how we think about them. And these strategies, these proactive strategies, always need to be person-centered. It could be about improving that person's quality of life. It should be about increasing choice and control for the individual. It should be about building relationships. They should give opportunities to increase positive emotions on the part of the individual. Achievements that are important for the individual. We all love to achieve things. They also should be, the proactive intervention should, obviously be about good health, and not only physical but also mental health. And it's also about creating an environment that's tailored to that individual's needs, not necessarily your needs, but to that individual's needs. I just want to talk a little bit about active support engagement. One of the things you will notice is some of these things talk about group activities. Now, obviously, because this is a webinar and because it's a truncated webinar at that, group activities aren't the type of thing we can do. So we've had to sort of change our approach, and that means that in many ways what we're doing is from our point of view, is telling you things as opposed to have some interaction. So while we apologise for that, there doesn't seem to be a great deal we can do. So active support encompasses a range of approaches which aim to provide enough help to enable people to participate successfully in meaningful activities and relationships so that they gain more control over their lives, develop more independence, and become more included as a valued member of their community, irrespective of the degree of intellectual disability or the presence of behaviours that challenge. Primary outcome of active support is engagement in a meaningful way, in meaningful activities and meaningful relationships, and look to really support that individual and the individual's requirements and how they're being supported and the nature of the activity or interaction that they're engaged in. Just talk a little bit about skills building, and I think again this is really important, not a group activity, but it's important that we actually help the person we care for build coping and tolerance skills. build functionally equivalent skills, skills that help an individual meet the same need as their behaviour currently doesn't, or that meet the same needs as their behaviour currently does, I suppose. They should also need to develop general skills that will support them in the completion of everyday tasks. So that's proactive strategies. Just to think a little bit more about reactive strategies. Reactive strategies are any strategy that helps us manage the level of immediate risk and ensure that safety once the behaviour is beginning to occur. So once the behaviour has started, our reactive strategies are there in order to help us manage that. They never change behaviour, they just enable us to keep people safe. So here's an A to F, I suppose. Active listening, thinking about that, thinking about listening to what the person is looking for. Diversion, changing the approach, changing staff, changing the environment, moving to another space. Redirection to preferred items, again, moving people to something else. Redirection to obsessive or compulsive behaviours. So these are all things that can actually don't change the behaviour, but they enable us to keep that individual safe by changing the situation, I suppose, whether that's by active listening, changing people, moving spaces, looking at other things. Now, what we have here as we come to the end of this, as I said, very brief run through on understanding challenging behaviours is some links to some further learning and further reading, I suppose. Now, one of the best places we think to go for around looking at challenging behaviours that challenge, is the Scope website. It's up here, scope.org.uk, and if you put in what is challenging behaviour, you'll be directed to some of the resources they have there. Also well worth looking at www.challengingbehaviour.org.uk, a really useful website there. And if you're looking at things like STOMP, which is as mentioned before, about reducing the amount of unnecessary medication, there's you can find more information on that on the NHS UK learning website, and that's really important as well. Now, I hope that you found that very whistle-stop tour around behaviours that challenge of use to you.